Today I'm going to speak with you about Parkinson's disease, about animal model for Parkinson's disease, and what we've learned from this animal model in order to treat better our human patient. Parkinson's disease is one of the most common neurological disease. We believe that it is affect about 1% of the population above 60 years. And with the increased life expectation in Europe, Israel, United States, we are going to get more and more patients with Parkinson's disease, and therefore it's critical to improve our ability to treat this disease. We know about Parkinson's disease for about 200 years. It was discovered by James Parkinson, an English physician, who treated 3 patients, and another 2 he noted on the market. It then described the main feature of the disease, which are akinesia, which is reduced amount of voluntary movement, rigidity, muscle stiffness, and tremor. We know today that this disease is the result of degeneration or the death of dopaminergic neuron in the brainstem of this patient. The question that we have been asking ourselves, what is the relationship between the degeneration of the dopaminergic neuron and the clinical sign that we do see in Parkinson's disease? The solution to this question came from another story, which is the MPTP neurotoxin. The MPTP neurotoxin was discovered by drug addicts in United States. They were trying to use the candidate or a replacement for heroin, a kind of artificial heroin. But unfortunately, they injected to themselves also the MPTP neurotoxin and developed all the severe signs of Parkinson's disease, starting from degeneration of the dopaminergic neuron up to the akinesia, rigidity, and tremor. We've been able to use this neurotoxin in order to mimic the human disease in animal model. And this animal model enables us to understand that after the generation of the dopaminergic neuron in the midbrain, we get increased activity in some part of the basal ganglia, especially in the subthalamic nucleus, which is a small nucleus below the thalamus that provide excitatory drive to the basal ganglia. We then have done the next step. We ask ourselves, can we ameliorate the Parkinsonian symptoms by inactivation of the subthalamic nucleus? And indeed, in 1990, we published that we are able to cure Parkinson's disease by inactivation of the subthalamic nucleus in animal model of the disease. 3 years later, Professor Benabid and colleagues in Grenoble, France, took this idea to the human clinic. And indeed, inactivation of the subthalamic nucleus by deep brain stimulation of the subthalamic nucleus result in amelioration of Parkinson's disease in human patients. Since then, in Europe, United States, Israel, and all over the world, more than 35,000 operations have been done. And patients with very, very severe Parkinson's disease are today treated by the DBS procedure with very, very nice restoration of their ability to carry out normal motor, social, and everyday behavior. Today, we are in this stage that we are able to offer our patients that are unable to use the drug therapy of Parkinson's disease. We have now a second step, which is the neurosurgical treatment. Of course, this day we are looking for the future. One possibility, and this is the most attractive possibility, is to prevent Parkinson's disease. We are looking for neuroprotection method. We are looking for ways that will prevent the degeneration of dopaminergic cell. In parallel, we are trying to improve deep brain stimulation, for example, by creating closed-loop methods that will look for better adjustment of the stimulation parameter with the dynamic change of every minute changes of the Parkinson's disease. Of course, there are many, many more questions to be asked, many more answers to be found, but we believe that this proper combination of animal experiment with good model of the human disease and careful testing of our idea, first in the animal model, then when it's successful, going back to the human theater, this is the way to get future advance in the treatment of this common disease. Thank you for your attention.